Inside a memory care neighborhood at Eskaton, residents gather around a humanoid robot named Abby. Some sing, some dance, others simply watch closely. Can moments like these improve connection and reduce loneliness over time? Researchers from the Betty Irene Moore School of Nursing at UC Davis are leading a first-of-its-kind U.S. study examining what happens when a social robot becomes part of daily dementia care.
Robots are here. We know they're here, we know that they're coming even more, and everyone is interested in how they are going to impact, or if they can impact, healthcare in a positive way.
The team of nurse researchers will follow interactions inside the community over the next year, studying how residents, staff, and families respond over time. That long-term approach is important because most previous studies have only captured brief encounters in controlled settings.
Nurses are the ones who spend the most time with patients or with residents. For us to be managing and running and designing a study, combining our skill set with observation and spending time with residents and patients, along with our scientific training, is a very unique perspective to bring to this, and I think a really important one for society.
Pink. Brilliant choice. We're twins today with a splash of color. Feeling pretty fabulous, aren't we?
Oh, we are.
The study is not measuring whether technology can replace care. The goal is to better understand whether tools like Abby can help support moments of connection in busy care environments.
Abby sparks a lot of joy during these interactions, and we see that lasting even longer than just the session itself, but it ripples into the rest of the day.
Anything else you're wondering about?
And I'm just really eager to continue to see, is it sustainable? Will it continue to be that impactful in the long term?
That companionship is exactly what Andromeda Robotics hoped to foster when designing Abby.
The U.S. Surgeon General has said that loneliness is an epidemic and particularly impacts the elderly. Sometimes within communities like this, people don't get a lot of visitors. We want to see that she really is providing that benefit that we've built her for.
This longitudinal 12-month study will tell us that. She's not replacing staff in any way, but she is sort of facilitating an interaction that otherwise might not have been in the same way.
The work is expected to provide some of the first real-world data on how emerging technologies can be thoughtfully integrated into dementia care while keeping human relationships at the center.